everyone, I'm going to talk about depression. Depression, it is also known as major depressive disorder in a clinical term. So it is also one of the common mental disorder that most people suffering in our localities. We have seen that people they get confused about depression from a momentary sadness or depressed mood. So to understand what depression really means, I'll talk about the diagnostic criteria of depression from a DSM-5. A momentary period of sadness are inherent aspects of human experiences and it is considered normal. So this period should not be diagnosed or considered depression unless a criteria are met for severity. So in total, there are 9 symptoms of depression and 5 out of these 9 symptoms should be present most of the day or nearly every day for the last 2 weeks. And this should cause a clinical significant distress or impairment to an individual to consider as depression. So the 9 symptoms of depression are: a person will be in a depressed mood most of the day and it is indicated by either subjective report or observation made by others. In children and adolescents, they are seen irritable for most of the time. Another symptom of depression is loss of interest or pleasure in nearly almost all activities at least some degree. The individual may report feeling less interested in hobbies or not feeling any enjoyment in activities that were previously considered pleasurable. For example, a person who enjoys playing football would no longer play or they would no longer find interest in playing football. Appetite changes are also seen in a person in depression. This involves either a reduction or increase in appetite. Some depressed individuals report that they have to force themselves to eat, while others may eat more or may crave specific foods. When appetite changes are severe, there may be a significant loss or gain in weight, or in children a failure to make expected weight gains may be seen. Sleep disturbances are also symptoms of depression. So it takes in the form of either difficult sleeping or sleep excessively. So most of the time, the reason that the individual seek treatment is for the disturbed sleep. Psychomotor changes is also one of the another symptoms of depression, which means a person will report feeling restless or inability to sit still or slurred speech, thinking and body movements. The decreased energy, tiredness and fatigue are also common in depression. A person may report sustained fatigue without physical exertion, and even the small tasks seem to require much effort for them. A sense of worthlessness or guilt is also associated with depression. Many individuals with depression report impaired ability to think, concentrate, or make a minor decision. They may appear easily distracted or complain of memory difficulties. So thoughts of death, suicidal ideation, or suicide attempts are also common in a person with a depression. So the possibility of suicidal behavior exists at all times during depressive episodes. So the most consistently described risk factor is a past history of suicide attempts. So these are the 9 symptoms of depression, and to diagnose depression, almost 5 symptoms out of these 9 symptoms should be present most of the time or almost every day for a duration of 2 weeks period, and it should represent a change from a previous functioning. So these symptoms causes clinically significant distress or impairment in social, occupational or other important areas of functioning. For example, if a person is a housewife, her normal functioning like doing house chores would be impaired. And all the symptoms that I have listed, that I have mentioned before, it should not be caused by any physiological effects of substance or other medical conditions. So now I'll touch on briefly about the causes of depression. So there are multiple factors that causes depression, and we explain it through biopsychosocial model. It is a model where we explain the causes of a particular disorder through biological, psychological or social factors. About the biological factor, if an individual from a family has depression, then a first-degree family member are by 2 to 4 times at higher risk of getting depression than the general population. So heritability accounts for approximately 40%. However, having a parent or close relatives with depression doesn't mean that you'll automatically have the same experience. So life circumstances and other personal factors are still likely to have an important influences. The changes in brain chemistry caused due to substance use can also cause depression. So now talking about the psychological factors. So characteristics like negative patterns of thinking, deficits in coping skills, judgment problems, and impaired emotional intelligence can also cause depression. Social factors. So social factors like experiencing traumatic situations, for example, harassment or bullying, a motor vehicle accident, rape, or any other traumatic situations can cause depression. And early separations, for example, a child separated from a parents or caregiver from a very early age, a lack of social support. These are some of the factors which influences or which can impact in depression. So the research has shown that stressful social situation events are capable of serving a trigger for turning genes on and off, causing change in brain functioning. So now about the treatment. So treatment, generally there are two forms of treatment for depression: the psychotherapy, which is also known as talk therapy or counseling, and pharmacotherapy, which is through medication. So medication is mainly aimed at relieving symptoms or to help with sleep. So however, counseling can benefit in managing the disorder in the long run. So combination of medication and psychotherapy is the best preferred treatment for depression. So these are all about depression, and I hope it would help in recognizing and getting a professional help. So thank you.